researcher, professor, and physician Dr. Thomas C. Fried briefly answer the questions regarding cancer and big profit.
Do you think money, industry, and economic markets influence the way we perceive cancer treatment and cancer as a whole?
I think there's a lot to be said for that. We all know about physical toxicity. The reason why people fear cancer is because they don't want to have to lose their hair and vomit and die, and all these. We call those physical and mental toxicities. But we also have a new form of toxicity called financial toxicity. So you can't
Greed,
believe how many
lies, and deceptions.
folks in this country that aren't well off are more or less living paycheck to paycheck, and then they get hit with a cancer bill for $30,000.
We've been there.
It causes families to disintegrate. People commit suicide. It's a tragedy of monumental proportions, and it's called financial toxicity, and it's just as deadly as some of the physical toxicities that we're associated with. So why should drugs that don't work for so many people, you should charge people only after the treatment works. You should never pay up front for any of this stuff.
Amen.
If it works, then you should pay. You should have some sort of a payment system. The longer you stay alive, the more you pay. You shouldn't pay $30,000 and then in a year you're dead. This doesn't make any sense. So we need to change the way we view the treat. How successful are the treatments? You go to the physician. He charges you a
90%
procedure.
is flawed.
Okay, some of this is expected, but a lot to be charged for drugs that cause you to have your hair fall out, your gut destroyed, and all these other horrible things. Why are you paying all this money for something that's causing you harm?
And you age 20 years faster.
Yes, and there's a huge industry associated. The cancer industry is known to be one of the wealthiest. I mean, they make
The big
billions of
pharma.
dollars on these drugs. But if you're okay, I don't think people would mind it too much if the drugs actually worked. Why we got, as I said, we got 70 people dying this hour that we're speaking, and many of them have taken some of these drugs. So,
All of them.
And they fail one after another. And not only that, if you do happen to survive, and believe me, there are millions of cancer survivors
Miserably
who have survived the
surviving.
so-called standard of care, but a good number of those folks now suffer from digestive, hormonal,
All of them,
all
not
kinds
good
of physical ailments that actually reduce their survival on the planet. And you die from other things. Oh, you were cured of your cancer, but now you die from heart disease, and you die from bone density issues. You die from all these other things as a secondary effect of being treated with very, very toxic approaches. So, and that's what people don't want. They would like to be treated for the disorder with something that's not going to be harmful, that actually makes them their outcome better. And this is what we published, this Press Pulse, where we gradually degrade the tumor slowly as we enhance the health and vitality of the body. There should be
Through
no
diet
hair
and
loss.
nutrition.
Anytime you see a cancer patient that's bald, why that person is bald? You're trying to kill the tumor cells, not the hair follicles.
Right.
I mean, let's be honest. I mean, you get off-target effects that you shouldn't have off-target. We specifically kill tumor cells by taking away the only fuels that they use to survive, which is glucose and glutamine. And the people get healthy. As you're degrading
But your
the tumor,
food is full of
you're
those.
also getting rid of a lot of other
American junk food.
Collateral problems like diabetes, high blood pressure, hypertension. A lot of these things go away along with the cancer. The problem right now is what I've just shared with you is not known or understood by the majority of healthcare
They don't
providers in
even
this
care
country.
to know.
That's the problem.
There's no money
a
in
lack
it.
of information dissemination.
Lack of
what else?
honor.
The science is clear. The problem is the word is not out there. And people then run off to the oncologists. And when you ask them about metabolic therapy, metabolic oncology, they never heard of it. So your very healthcare providers are almost clueless as to the biology of the disorder they're treating.
And we are the
If they don't
victims.
know that it's a metabolic disorder, that's a tragedy. And the consequences are 1,700 people a day dying from this disease.
So you might
Because of lack of knowledge, my people perish because of lack of knowledge.